Hey, this is Dr. Pete. I wanted to talk to you about another Dr. Pete, Dr. Peter Attia, who's a longevity expert. He came up with this concept of the marginal decade. In essence, what do you have to do now at X age in order to get to your goal decade and be that functional? Anyway, the guy's work is excellent, generally speaking, and he comments on a lot of things. One of the things that he used to do a lot of that he's doing less of now is intermittent fasting. And I think what's so important about this discussion is that a lot of the headlines are that Peter Attia doesn't believe in intermittent fasting anymore. And the reality is that's not true. Let me tell you what he used to do for intermittent fasting, because it doesn't sound like the Athos diet or Orthodox fasting. He used to every 3 months do a 7-day water fast. So no food whatsoever, just water. And then once a month, he would do a 3-day water fast. He did this for 3 years, and he tracked his lean body mass, and specifically his muscle mass, and he noticed he had a 10-pound drop of muscle mass. So first of all, that's over 3 years. Second of all, that's a pretty rigorous set of water fasts. I mean, 7 days in a row. I don't know of any Orthodox tradition or any monastery that practices that every 3 months. I don't know one that practices a 3-day fast every month. And so, again, in the wisdom and balance of the church, I think that intermittent fasting daily makes the most sense. And of course, when you're intermittent fasting in that pattern, it means that ultimately during your eating window, you are having the opportunity to eat good nutrition, keep your protein up, and prevent muscle loss. And we actually know that growth hormone, which can increase by like 1,500%, I think in some estimations, 500 to 1,500%, depending on how long you're going for, it actually is a hormone that preserves muscle mass. So there's all the physiology there to keep your lean muscle mass preserved through a fast. And, there really is no recommendation to do a prolonged water fast of 7 days or even 3 days. We're talking, 16 to 20 hours a day. And so if you're doing that, you're staying enough balanced, you're keeping your lean body mass, and you still get all the physiological benefits. So something to say, and I will also want to quote Dr. Peter Attia. He sees no problem in shorter fasting periods. He just doesn't do the extreme anymore. And of course, it's an old Greek saying, everything in moderation.